As we all might have heard, diabetes is one of the leading causes of death in the United States. Diabetes occurs when our blood glucose, similarly called the blood sugar level, is too high. Blood glucose is a crucial source of energy and comes from the food we eat. Insulin, a hormone made by the pancreas, benefits glucose from food to get into our cells, which can be used for energy. This is a long-term disease without a cure. However, we can manage this long-term disease very well if we can follow the right practices. Knowledge about what to do can be beneficial to control and manage the disease. These steps are simple but crucial. Following them regularly can help us to control diabetes. Let us see what we can do to beat diabetes. Number 1. Routine blood tests must be performed. By measuring blood sugar at home, we can track our blood sugar level. The average blood sugar level after overnight fasting is less than 100 milligrams per deciliter. A1C blood testing looks at the average blood sugar level over a period of 3 months. The A1C goal for most people with diabetes is 7% or less. This is an average of blood sugar around 150 milligrams per deciliter. This routine blood sugar measuring can help us to tightly control blood sugar level. Number 2. Routine urine tests are usually recommended once per year. This helps to identify any damage to the kidneys. The presence of protein called albumin in the urine is called microalbuminuria. This is a concerning finding, and both blood sugar and blood pressure must be tightly controlled to avoid further damage to the kidneys. Number 3. Another critical organ that can be damaged by a high sugar level is eyes. Regular screening of the eyes can help us to identify any early damages to the back of the eye, which is called the retina. Usually, a retinal exam is recommended for diabetic patients every 1 to 3 years. Diabetic retinopathy can cause blindness. Early detection can help to make the necessary steps to avoid the progression of further damage to the retina. Once again, blood sugar and blood pressure must be well controlled to prevent further damage. Number 4. Regular physical examinations by the healthcare provider are critical. This can be helpful to identify any damages caused by diabetes. Neuropathy is a common complication of diabetes. It can cause damage to the nerves. Annual monofilament testing can help us to identify any nerve damage. Nerve damage can present as numbness, weakness, tingling sensation, or even pain. This is typically occurring in the distribution of gloves and stockings. Number 5. Regular exercises can be highly effective in controlling blood sugar levels. When we do exercise, our muscles need energy. Then the muscles get the energy by taking the sugar within our blood. This helps to lower the blood sugar levels. At least 150 minutes of moderate intensity exercise per week can be highly beneficial to lower the blood sugar levels. Regular exercise can help us to reduce weight. Studies have shown that reducing weight can prevent diabetes in people who are at risk. Number 6. What we should do if we have diabetes is always to have a snack standby. Hypoglycemia is low blood sugar level. This is a dangerous, life-threatening complication seen in diabetic patients. When blood sugar levels are low, we can have symptoms like sweating, trembling, feeling hungry, and anxious. Some people do not have these symptoms and they can pass out due to low blood sugar levels. The best way to control low blood sugar levels is to regularly check the blood sugar levels and be always ready to treat low blood sugar. It would help if we have always carried fast-acting carbohydrates such as glucose tablets or hard candy. However, after the episode, we should inform our healthcare provider to get more help to prevent any future episodes. So now we know the 6 of crucial practices to follow if we have diabetes. Following these simple steps can help us to get control of our diabetes. Managing diabetes well can promote to live a happy and healthy lifestyle.